This module focuses on the planning on your implant case. These are the overview of the video. Spread among practitioners. With increasing demand from patients and heavy marketing by the companies. First, do we know what a dental implant is? Basically, it is just like any other implant that the doctors implanted into any other parts of our body. Except for dental implant, it is inserted in our oral cavity. Dental implant is surgically placed into the oral cavity to support the dental prosthesis in order to restore patient's functions in terms of mastication, phonetic and aesthetic. When considering implant treatment in a particular case, the practitioner has to evaluate whether oral implants are indicated for this particular patient, for this specific oral situation, and within the framework of a comprehensive reconstructive treatment. Planning in order to come up with a proper treatment plan and better outcome. A good treatment plan will ensure satisfactions to both parties, which are the clinicians and the patient receiving dental implants. These are few of the examples of why a good treatment planning is important to both the clinician and patient. Treatment planning is important to prevent these unfortunate events like malposition of the implant. Malposition could be the implant is placed too close to each other, where certain millimeters has to be considered if two implants are going to be placed adjacently. These malposition could make the restoration for the prosthesis impossible in the near future. There are also few cases where implant was placed out of the alignment of the alveolar ridge. And these cases would certainly give a poor treatment outcome and lead to dissatisfaction for the patient, especially on the aesthetic area. Periimplantitis, which is the inflammation that occur around the supporting tissues of the implant as well as involving the loss of alveolar bone, also can occur if no proper treatment is done. During the first consultation, possible implant contraindications should be ruled out during the course of the examination. A medical status of the patient should be asked, including the past and current diseases, temporary and long-term medication, smoking status, and special dietary features. Additional questions address the age of any existing prosthesis and the presumed reason for tooth loss. Recurrent decay indicates a high caries activity, where it could be a decisive factor as to whether to maintain or replace a questionable abutment tooth. Patients with a periodontal history are at higher risk for potential periimplantitis leading to late implant failure. Anterior tooth loss following accidental trauma is frequently associated with advanced alveolar ridge defects, and potential involvement of adjacent teeth has to be ruled out. General contraindications for implant treatment are rare and mainly related to an increased risk for patients undergoing the surgical procedure. The chronological age per SE is not a contraindication for implant placement, but, particularly in older patients, the decision should depend on the treatment necessity and patient's ability to tolerate the procedure. These are the examples of the medical problems that makes an implant placement impossible. The clinical examination comprises several extra and intraoral aspects, giving special attention to the alveolar bone and soft tissue contour and the possible implant reconstruction. These are the extraoral parameters that must be considered before an implant placement. Correct facial proportions. Need for lip and cheek support. Patients with removable prosthesis should be evaluated with and without the existing restoration in place, so that a prosthesis flange for adequate support can be planned if deemed necessary. Facial skeletal classification. Intermaxillary relation, occlusal vertical dimension. Neurologic test of areas innervated by the trigeminal nerve to ascertain any sensitivity anomalies to serve as a baseline assessment in case of intraoperative nerve lesions. Temporomandibular joint movement and function, contraction or hypertrophy of the facial musculature as an indicator of parafunctional habits. The intraoral examination comprises dental examination including existing restoration scanned reconstructions, decayed and filled teeth, oral hygiene assessment, periodontal exam and dental pulp test, detection of malpositioned teeth midline between upper central incisors corresponding to the philtrum position. Edentulous regions, ridge defects whether it is vertical, horizontal, or combined, crown to bone relationship. Quality and quantity of the mucosa and contour of the underlying bone, any pathologies and pressure spots are recorded and the magnitude of the alveolar ridge resorption is examined. Existing prosthesis, prosthesis basis, inter- and intramaxillary relation, size, form, position, color of denture teeth. Depending on further planning, a decision is made whether the existing restoration is sufficient and tooth arrangement is applicable to the new restoration, whether this restoration can serve as provisional, or whether an additional diagnostic setup and an interim prosthesis is required. Occlusal status and functional exam. The diagnosis of parafunctional habits can be deduced from clinical findings of muscular tension and hypertrophy, dental abrasion, attrition, and wear facets. This is an example of the patient assessment form adapted from Zitzman et al., 2008. For the three different starting points, specific aspects for implant treatment planning have to be considered during extra and intraoral examination. Single tooth replacement. The decisive aspects whether a single tooth implant is indicated or a fixed dental prosthesis is preferable are related to the condition of the adjacent teeth and the neighboring anatomic structures. Sound tooth structure of adjacent teeth, converging root alignment, sufficient bone quantity and thick soft tissue quality are good predictors for a successful implant therapy. Partially edentulous case. A major indication for implant placement is the free end situation when removable appliances should be avoided. Edentulous case, especially in restoring the edentulous jaw, it is important to evaluate and specify the patient's desires and expectations related to implant therapy, which may vary greatly. Others suffer from recurrent sore and pressure spots on frail soft tissues and benefit from solely implant-supported prostheses, removable or fixed. Preoperative radiographs are required not only to evaluate the existing bone quantity but also to identify neighboring anatomic and topographic structures which have to be preserved. Important anatomic structures are the roots of the adjacent teeth, the course of the inferior alveolar nerve, the floor of the nose, the diameter of the incisal canal, and the morphology of the maxillary sinus. The radiologic examination also aid in facilitating the evaluation of the bone quantity in the bucco-oral dimension, better orientation for the identification of anatomic structures and/or optimal implant positioning. This figure shows the radiologic diagnostic needed by a practitioner for specific cases. Broadly speaking, expectations are beliefs about future consequences, which may contribute to an individual's psychological and physiological change. There is a strong need to further develop the concepts of patient expectation and investigate both theoretically and empirically its implications for patient-reported treatment outcomes. This need is even more pronounced with regards to treatments with dental implants, where expensive therapy is proposed for the rehabilitation of function and aesthetics of patients with missing teeth. Many studies had been done to evaluate the patient's satisfaction and expectations towards dental implant. A study by Barakat et al. In 2011 found that patients' satisfaction towards dental implant exceeds their initial expectation. However, another study by DeLima et al. In 2012 reported satisfaction lower than pre-treatment expectations, especially for aesthetics in patients who received implant-supported fixed partial dentures. The lack of reliable information may be one reason leading to the development of patients' unrealistic expectations. Another possible resource for unrealistic expectations is the perceived novelty of this treatment, especially when coupled with the high cost of the implant therapy. Based on the view that patients' unmet expectations would negatively influence their satisfaction with the treatment outcome, identifying patients' expectations before the treatment is a necessary step to prevent patient disappointment with the final treatment outcomes. Information about implants is widely available through internet and social media, but with limited quality assurance and often misleading or inappropriate content. As communication bias, uncertainties of diagnosis and therapy often lead to misunderstandings. All unmet expectations may cause future dissatisfactions.